Welcome to the noon meeting of the Rotary Club of Baton Rouge. Before we start, please remember to turn off your phones, not silent or vibrate, but off. It interferes with our live streaming. The invocation will be led by George Bell. After that, the pledge by Tina Holland. And after the pledge, please stay standing for the four-way test.
Please join me in prayer. Heavenly Father, first, I'd just like to thank you for the joy of fellowship and the privilege of the friendship that we have as members of this organization. We thank you for all that you've done for us and all that you're continuing to do for us and for the work that we do in our communities. Lord, we ask that you bless those that are present, bless the families of those that are present. Ask that you provide for each leader the wisdom, the courage, and the strength needed to carry out your desire in our lives. Now, Lord, we just thank you again for the food, the nourishment that it provides, and the hands of those that have prepared it. We give thanks. Thank you, and these things we ask in your precious name. Amen.
Amen. With allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Truth is fair for all concerned. Will it build goodwill and better friendship? Will it be beneficial for all concerned? Tina Holland will now introduce our guests.
Please join me in welcoming our guests today. As I introduce our visitors, would you please stand to be recognized? And members, please hold your applause until after all of our guests have been introduced. Paul Mason, guest of Barbara Clark. George Bahi, guest of Liz Hampton. Mary Milton, guest of Liz Hampton. Ike Jackson, another guest of Liz Hampton. And Michelle McCullough, also a guest of Liz Hampton. Chase Weatherly, guest of Matthew Laborde. And Brent Deloach, guest of Sherry McBeat. Beverly Brooks Thompson, guest of Judith Roberson. David Tidwell, guest of Janet Simmons. Also a guest of Janet Simmons are Derek Veed and Burnell Smith. Monica Winkler, guest of Stephen Winkler. Stephen also has guests Alex Shelton, Stephanie Anderson, Kurt Scott, and April Chison. Guests of Shard Richard, Mendy Richard, and Bill Slaughter, guest of Christel Slaughter. Welcome all of our guests, please.
Franz Bogart will now introduce our newest member.
So we're in strange times where our newest member has been a member of the club for about a year now. I only have a minute, Brian, so I'll be as quick as I can be. When I look across the room, I see a lot of good people, and the thing that comes to mind is what a group of good people needs is more good people. And Brian is that guy. Brian is a genuinely good person. He's going to be a great asset to this club. He is a husband and father of 3. He has worked in radio broadcasting for nearly 2 decades. He has a morning show on Talk 107.3 that emphasizes and focuses local. I will say that he also mentors other individuals who are trying to get into the radio business. He is very active at Our Lady of Mercy. He is a stellar basketball coach, although he wrote mediocre girls basketball coach. He nerds out to fantasy football and Sopranos, but I will assure you that he nerds out to much more than that. So ladies and gentlemen, it's my pleasure to introduce Brian Haldane.
Brian, welcome to the club. Today's head table, to my right, your left, Tina Holland, President, Franciscan Missionaries Our Lady University, that's a mouthful. Franz Bogart, owner, Bogart Law Firm. Brian Haldane, our newest member. Past President Haggai Davis. Why are you sitting up here?
Yeah. I can't get away from the mic, all right?
Customer Success Manager, Jennifer Informatics. I'm Maui Tachi, your club president. Christel Slaughter, she's a member of our club, and our speaker, who will be more formally introduced shortly. Shard Richard, Managing Director and Executive Vice President, Alliant Benefits Services Incorporated, and George Bell, President and CEO, Capital Area United Way, who led us in the invocation. An announcement, next week, it's our off-site at LSU. Coach O, please don't come here. We already have a waiting list. There are no walk-ins, so if you're not registered, please don't come because the fire marshal will not let you in. We already have a waiting list, so unfortunately we are all booked. Christel, every week our club donates a book to Crestworth Elementary, and it's donated from the Rotary Club of Baton Rouge Foundation. And this week, the book we've donated is Cassandra Steps Out by Isabelle Bautier. Thank you. And now Shard Richard will introduce our speaker.
Thank you, President Maui. It's my distinct honor and pleasure to introduce our distinguished speaker today, Christel Slaughter. We know her as Christel Slaughter. It's actually Dr. Christel Slaughter. She has been the CEO of SSA Consultants, and she has led corporate organizational transformation involving strategy, growth, cultural change, performance improvement. She's a native of New Orleans, and she earned her bachelor's degree in marketing and received her doctorate in systems management and organizational design at 25 years of age from the E.J. Orso College of Business at LSU. In 1983, and I was quick to ask her this question, at the ripe age of 12, she joined SSA Consultants. So while she's been with us a long time, it started very early. As an organizational consultant, Christel specializes in leadership development, executive coaching, change management, performance improvement, and strategic planning. Some of her work includes guiding the cultural and organizational transformation of publicly traded community bank, designing and implementing an award-winning customer service program for a large healthcare institution, developing and conducting a diversity awareness program for a multinational chemical company, and designing integration strategies for the state of Louisiana's multi-billion-dollar coastal protection and restoration efforts. One thing you learn about Christel, if you do any bit of, you take a look at her bio, and I was able to condense it into one piece of paper. I thought we were going to have to bring a scroll out here. And it's very distinguished past. There's really two distinct areas past of her contribution to our community and state. Obviously, you know about her professional involvement and accomplishments. They're immense. But her community service is exemplary. You know, Christel has served, there's so many organizations that she served on the board previously, continues to do so. Most people here know that she served our club as president in the year 2003-2004. She was our 88th president and served distinguishedly there. And so I'll close and introduce her on this note. When I was young, my mother used to kind of define things to me in very simplistic terms. It's probably because she says, hey, we probably got a pretty simple-minded child here. We better break it down in simple terms. But she said, son, the world is going to be full of doers and takers. And she said, she tried to explain to me and emphasize the importance of each. But she said, you need to be on the side of the doers. And Christel, you know, there's no other way for me to describe her saying she exemplifies that term. She is a doer and a giver. And it's with my great honor and privilege that I introduce her to speak to our club, Dr. Christel Slaughter.
I said, Shard, that was the short version, right? He promised he wouldn't do that. You can come to my funeral and give the eulogy. How about that? I will sign you up right now. It is such a pleasure to be here, and I was very delighted to be invited to speak and very intrigued with the topic that we decided on. And of course, no better timing than when we're having changes in our healthcare market, literally on the day of a Rotary speech. So someone who is the program chair had a lot of forethought and obviously a crystal ball. But there are a lot of changes going on in healthcare, certainly not just in Baton Rouge, but all over the world. And I do think it's kind of interesting to take a pause and think about that. Bill and I went to a function for the new president of LSU on Saturday night, and I had a colleague who I'm looking around the room, I don't think he's here, although he's a member of Rotary. He said, "What were you thinking accepting that invitation? You're not really going to talk about that, are you?" And I said, "Well, I was. Why?" He said, "Because you're not from out of town and you don't have a briefcase when you stand at that podium." And he said, "You only are an expert when you are from 50 miles away with a briefcase." And that is true. But I think that, you know, as I was preparing my remarks today, and I'm looking around the room, there's so many people who have been in Baton Rouge for many decades, were either born and reared here or came back here. And so I want to start, as we think about the changing landscape, to think about where we came from. We were just talking about my coming from New Orleans. And in New Orleans, I grew up with very, very dispersed healthcare systems. I wouldn't even say there were systems. There were different hospitals. There was Baptist Hospital and Mercy Hospital and Hotel Dieu and Touro and so on and so forth. And when I moved to Baton Rouge in the 70s, it was a different healthcare market. It was very, very different. And I think that, you know, if you think about the major players, we had a lot of people who had long-standing allegiances to one another. And so if you go back to the origins, Franciscan missionaries of Our Lady, they actually traced their roots back to France in 1854. Baton Rouge General was started in the year 1900. So we had our Catholic institution. Baton Rouge General was originally a Baptist institution. Not in Baton Rouge at that time, but in 1942, Ochsner was started. And in 1968, Women's Hospital was started by a group of doctors who had been practicing in other places and decided that they wanted to leave and form their own organization to serve specifically women and provide for women's health care. And then we also have something that's a little bit unique. If you go out of this market, we have some large groups of physicians who have come together and stand for excellence either in their field of specialty or in multi-specialty, as in Baton Rouge Clinic, 1946. I believe there were 4 doctors who started the Baton Rouge Clinic. That's a very unusual model to still be financially viable and in existence today. I just don't see that in a lot of other communities where we do consulting. And I think that it is sort of a direct result of the market, where the market was, where it's come from, where it's going, their ability to renew themselves, et cetera. But the same is true of the Bone and Joint Clinic and Neuromed a little bit later. The founders of Neuromed realized that they had a unique skill set and wanted to, you know, really be kind of in control of their own destiny. The interesting thing is that you really don't see a lot of those kinds of models today. And the same was true with the group that broke away from Women's Hospital, the Louisiana Women's Healthcare Associates. And here's what you may or may not know, but I was having a conversation with one of our partners, Rudy Gomez, who spends a lot of time consulting in healthcare, and I hadn't really thought about it this way. I know we have a lot of attorneys in here. If you are part of a large law firm, you get selected, you're in the law firm, you have certain policies about when to leave, you have certain exit strategies and agreed upon ways of getting out, and if you had equity or some partnership, how that would become lucrative for you. It doesn't work that way in healthcare. So think about today. Think about the amount of debt that a medical student has when they get out of medical school. It's astounding. It's absolutely astounding. They can't buy into a healthcare practice. They can't go to one of those groups that's listed on there and pay to be part of that practice. They can't buy in. You also can't get bought out because the model doesn't sustain itself that way. So when it's time to leave, and of course we know a lot of baby boomers are getting ready to hang it up, and in healthcare, a lot of people had a hard year. They're getting tired. They're saying, okay, I'm ready to go. And when they begin to exit, it's kind of like the Social Security system. Are there enough other people paying into it so that we can make this equation work? And so I think that that's why we don't see as many organizations like this in other parts of the country, because they were not able to convince younger people that that was a good place to practice, that they were going to be sustainable financially, and that they were going to really provide for their careers long term. I do think we have some great examples here, but the reality is that it is a low bar to entry and a low bar to exit, and you better make the money in the middle of your career because it ain't going to be there forever. So I think it's going to be interesting to see, changing landscape of healthcare, what happens with the remainders of the organizations that we have. And then in 2016, some of you know we formed the Baton Rouge Health District as a community. And I almost just took a slide, even though I hate lots of slides, with the logos that are on there, because it really is an amazing thing. And I think that's unique to Baton Rouge too, although I've done some research and there are similar things in other places. But you have the CEOs of payers. Blue Cross sits on there and is very active. You have the major hospital CEOs. You have Mary Bird Perkins CEO, and the Baton Rouge Area Foundation helps to convene them and have good things happen. That's very unusual. I was privileged to work with them on some strategic planning right before the pandemic, and the vision that these dedicated people have for our community, it's marvelous. They talk about population health. They talk about dealing with chronic diseases. They talk about can we lower healthcare costs for our employers? Wouldn't it be incredible if we set that as a goal and then we shared data, and as a community we sort of took people and we really managed them and we helped them and we collaborated with that. I mean, that's a 10 or 20 year project. That's not for a little 3-year strategic plan, but it's a beautiful vision. And you wouldn't even be able to take some communities that I've worked in, especially in very competitive markets in Florida and Texas, and even get the CEOs in the same room, much less to collaborate and to talk about the needs of the community. So I think we're very blessed and we're very lucky in ways that we don't even imagine. Now, we still have a lot of challenges, and we have a lot of change that's here and change that's coming. I think there are really 5 drivers, in my opinion. You can go online and you can find the 8 drivers, the 12, the 3, the whatever. But these are the ones that I see our clients really struggling with or having to deal with. And the first one is yet to really be, we still don't know the impact of it. So some healthcare organizations did okay during COVID last year, the first wave. Some did not. Elective surgeries were canceled. They lost staff. They didn't have enough PPE. People didn't feel safe. It was a very challenging time. And for the organizations in Baton Rouge who were able to get PPE through the goodness of the community, get meals sent to their staff, help people keep going, I think we were very blessed by all the people who stepped up to help. But we're not out of the woods, and in fact, we're going deeper in the woods, it seems like, than we did before, and faster. So everybody here needs to get their masks out. You need to, whether you've got vaccinated or not, you need to to reconsider your decision if you didn't, but you need to be prepared because we are really hitting a wall here. I'm part of a group that's working with the state, the Office of Public Health in the Department of Health and the Department of Education have received a very large grant from the federal government, as the other states have, to do COVID testing in schools. Now, I thought that was a great project. That was nice. I'm happy to help do some outreach on it. Until day before yesterday, when my almost 3-year-old granddaughter had to come home from her summer camp, which is a nice child care experience, because there was a child who tested positive. And later that day, another child who tested positive. No symptoms, totally asymptomatic. Young children cannot be vaccinated, younger than the current limit on that. Well, that threw my world into a spin. That threw my son and daughter-in-law's world into a spin. It threw the rest of the people who are in the office to have a 3-year-old child in there. No, she's very good and quiet. But as employers, I think we really need to think about how can we do this differently. We've got to keep our schools open. People have got to go to work. People will lose their jobs. Some of us are very lucky that we have employers who allow us to bring children to work, bring dogs to work, to work from home. We have the technology to do so. But the people who need their jobs the most do not. And so I'm going to ask all of you in here, as citizens, as business owners, as people who employ other people, to please encourage people to get COVID testing in their schools and to help faculty and students be safe through the coming months, because I think we're really going to have a tough time. And again, the more stress we put back on our healthcare system, the more problems we're going to have in the long run. There are a lot of people who don't feel like they had a chance to really get a deep breath since the first round, and now we're going into the second round. The amazing thing is that there are such good people in the world. Tina, where are you? Tina Holland? I know you're in here somewhere. Oh, you're at the front table. Accelerated programs in the middle of COVID to have respiratory therapists who have signed up, incoming respiratory therapists, and are taking an accelerated program so they can get bedside sooner. I mean, that's amazing. Bill and I went to the World War II Museum a few weeks ago when things finally opened up for a little while, and it reminded me of that spirit of, I have to help. This is a problem. And I know there are people like that all over the country. There are people like that all over the world. I just think we are extremely blessed here in Baton Rouge because we have that. We also have some political transitions. There were some things that the Trump administration did that were helpful. There were other things that were not helpful. There are things that the Biden administration are doing, considering, et cetera. Things that were important to our state were Medicaid expansion. It was very important that we have more people who had health care coverage and good health care coverage, and I certainly hope that that will stay. We have telehealth during the pandemic, which was covered by CMS, the major payer. Medicare was paying for telehealth, still are. I hope that continues too, but that will change the landscape of visits because, as you'll see in a moment, there are a lot of people who prefer looking at their phone and talking to their doctor than being there in person. And so I think we're going to see a lot of that. But in addition to the idea of payers and politics, we have some changes that are going on that many of you face every day. And so this chart, and obviously you can't read the numbers, but the visual is the point of the whole chart. Since 1999, annual worker and employer contributions have grown in those 20 years at the rate that you see. The dark blue is actually the employer's part of the contribution, and the lighter blue is the employee's part of the contribution. So we all feel that. I know when we do compensation studies, we have to figure out if there's a 28% load on an employee. We have clients all the time who say, well, I really need to hire someone else, but maybe I can do it on contract. Maybe I can get a part-time worker because I just really can't afford the health care. That creates pressure in a different sort of way. It creates it at the ballot box. It creates it in Washington, but it creates pressure locally. And I do think that, and I was very pleased, Michael, you can go back and tell Dr. Steve this, that the loudest voice at the table in the health district conversation was Blue Cross, who said, we've got to do something about this. It's too expensive. We've got to do it, and we want to help. So obviously, that's a long-term solution, as I said, but the reality is this is driving a tremendous amount of the change, and it's going to continue to drive change going forward. So healthcare's become a little bit more retail. Now think about healthcare for a minute. It's the only thing that you buy and pay for that you didn't really know what you were buying, right? Somebody else has got to buy it for you. The doctor's got to buy it for you. You want an MRI? Well, you can't just walk in a hospital and say, I'd like to have an MRI. Doctor has to order it, okay? So you have a third party ordering things. In some hospitals, that person is not even aligned with the hospital. They have credentials, but they may or may not be aligned with the hospital in other ways. In other places, those physicians are owned. Let me go back to that point for a minute. When I was talking about the good old days of healthcare, when I married my husband, my father-in-law, Dr. Slaughter, terrible name for a surgeon, Dr. Slaughter. You can't make this up. You have to be a really good surgeon if your name was Dr. Slaughter. Two interesting points. The first one is that the market was so different and so collegial at the time that in the same year he was chief of surgery at Our Lady of the Lake and chief of staff at the Baton Rouge General in the same year. And you saw that, and that was not an unusual sort of thing. Obviously, we outgrew that, but the fact is we're going to have to figure out how we go back to some things like that because we have a community and we need community health care. And sometimes we're going to be competitors in some things, and sometimes we need to be partners in others. And I do see that in some markets, and where it happens, it's wonderful and it does very well. But if you remember, Ochsner, I had the block on there that it was started in 1942. So that is just right after my father-in-law graduated from medical school. And so we found a big envelope in some family papers during the pandemic. It's a good time to clean out things, right? So we found this big envelope that we'd never looked inside. And when we opened it up, it had a leatherette booklet from his Tulane Medical School graduation. And it had a picture of his class. There were about 12 or 15 men in the picture. And among those were Dr. Michael DeBakey, credited with the first heart transplant, right? And John Ochsner. And then I remembered seeing a document, I don't know where it is, but it was notes that my father-in-law had written to his buddy John Ochsner about what he liked about what he was getting ready to do and what he didn't like about what he was getting ready to do. And his fear that if you employ physicians, where is the physician's loyalty? Is it to their patient? Is it to their employer? Now, don't take that literally, but just imagine how radical that was back in the day. Now we have our hospitals here employ 400, 600 physicians. We don't think anything of it. That's still a slightly different model. But the reality is that things in terms of healthcare have come away from the physician being the key to the consumer. And now we have come into a retail moment in time that is very, very interesting, and it's something we're going to have to navigate very carefully. The healthcare consumer is much more selective and much more cost conscious than they ever were. I don't know those of you who are still employed and working if you have high deductible plans, but a lot of our clients do. And it makes people very conscious of what they're going to sign up for when they actually schedule elective surgeries and things like that. And they do want more transparency. They want to see what things cost. They want to shop around. They want to compare. I knew the world had changed when Bill had some medical issue, and I came home one day and he said, well, I found a doctor who's rated 4.8. And I said, what? Bill Slaughter, he knows how to go on the federal website and see how people are rated and what, zoom around and that. Well, Curtis said he was good, and I think he is too, so I'm going to go there. That's rampant. We just got to get ready for that. Public and private insurance exchanges are making the consumer a more active participant. So we're being driven to be more active, and that's kind of good for everybody, I think, in the long run, although it's very different. Entrepreneurs, governments, payers, and health systems are bringing price transparency to the marketplace, some of them kicking and screaming the whole time, but I don't think there's much we can do about that. It's coming. And then consumers continue to be attracted to very convenient and cost-effective sites of care, retail clinics, virtual care, et cetera. I do have to tell you this funny story. I was looking around to see if my brother-in-law was here. So I was doing some work with the West Feliciana Community Hospital. Now, I just got to tell you, if you don't know, this is the best kept secret in Louisiana. They have their own emergency management system, and they have their own helicopter to airlift you anywhere you need to go, and that's paid for by the taxpayers. And they have a lovely, beautiful new facility where they can treat a whole lot of things that need to be treated, and then they can obviously take you either by ambulance or by air to wherever you need to go to get whatever else you need. Well kept secret. But while I was there doing strategic planning, we were talking about changes in healthcare. And I had a list of competitors to test with the physician groups, the different focus groups, the department heads, et cetera. And on there was Walmart. And, CVS, Walmart, where are you going to get your health care in the future? And so I said, so are you worried about any of these? And I'll never forget one group in particular. They were very smug about where they were and what they were able to do. And one of them said, we don't even have a Walmart in this parish. It's in Zachary. And we will never have a Walmart in this parish. And I said, well, then we don't have anything to worry about. There's no competition for health care in West Louisiana. Pick up your phone and see, where you can connect to, Cleveland Clinic or whatever. We'll talk about that in a minute. So I do think that, these are such new concepts that we're just really not quite ready for it. But when I tell you that things are changing fast, so just as we have a whole lot of baby boomers and we're starting to exit and we're starting to do things differently, we got more millennials. And millennials have babies. And millennials have little children. And millennials are very interesting consumers of healthcare. So a lot of millennials, research shows, do not have a primary care physician. Why? They get healthcare. They believe urgent care is a primary care physician. These are smart kids. These are people, our consultants, people that I meet on the street, my son's friends, et cetera. No need to have a primary care physician because urgent care is there. They're extremely cost conscious. I think that, when you look at the years that the older millennials have been in the workforce, they had some things that were pretty significant that really diminished their income and earning power. Some research says for the rest of their lives. Now, the later millennials, not quite as much, but I do think that you're going to see that push from that group for transparency. They judge a hospital or a doctor by how quickly their website loads. See, true, huh? True. What does TLGU mean? Too long, gave up. I had one of our young consultants write me that one day. I was like, did she have a typo? Is that, what could that be, TGIF? I mean, nobody says that anymore below a certain age, but too long, gave up. So if it doesn't load fast enough, if they're waiting too long for something, it's extremely frustrating. So research actually shows millennials' attention span is 12 seconds. The next group, Generation Z, their attention span is 8 seconds. So we got to get those search engines going. We got to get those websites loaded. But this is my favorite, and there's a whole body of research. So millennials who are parents have been nicknamed perennials. And so perennials have been raised by helicopter parents, those of us in the room who, have these wonderful children that we were very vigilant over. Now they become that kind of parent, even worse. And so there's nothing that's too good for their children. And, of course, the baby boomer grandparents help that out, too. And so they will do anything to get their child the best health care that they can. Now, that's an interesting fly-in-the-face sort of factoid, but I do think that we're seeing that in a lot of areas. And I think that, people who understand that, pediatric health care, we have a beautiful new children's hospital, we have Ochsner that's, specializing in pediatrics in the Baton Rouge market. There are people who understand what that means. And I do think that raises the boat for everybody. I think that means better health care for all. I will tell you this one thing since I mentioned about my granddaughter. 4 years ago, before she was born, I was doing some work for the Academy of Sacred Heart in New Orleans for Sister Melanie. And I was with the pre-K, the baby teachers, and we were talking about customer expectations and how to meet them and that sort of thing. And they said, well, they really like our texts and videos. And I said, oh, do you do videos? I said, what kind of videos? Well, every day we text a picture of their child, and on Friday we text a video, and it has their child somewhere in the video. So we have to get all the children during the week somewhere in the video. I said, you gotta be kidding. Oh no, they said, we text when they have a BM. And I thought, I've never heard of this. Until my grandbaby went to school, and my daughter-in-law gets that text and sometimes sends it to me. And I'm like, well, isn't that great? I really don't know what emoji to use when she sends me that. It's kind of like, wow, good, okay, everything's great. I think this group is going to really make some changes in healthcare, and it's going to be interesting for us to watch. Now, the number one driver, and I could have spent the whole time on this, the number one driver is the move from volume to value. I was hoping Terry Fontenot was going to be here today. You see that quote? She told me that in 2012. She was at a conference in the American Hospital Association, and they had a speaker that she eventually brought to Baton Rouge. And he said an organization like Women's Hospital, just because he was in Women's Hospital, has got to have 1 foot on the dock and 1 foot in the motorboat. And what he was trying to say is that healthcare is going to change. In 2012, it was happening in other parts of the country. It had not yet come to Baton Rouge. We thought it was going to come a whole lot sooner, but it didn't. And you begin to get kind of a little bit complacent that maybe it's not ever going to come here. Maybe we're just going to be a different kind of place. But it did come, right? And it is here. And what he meant was, you got to keep a foot on the dock, stay on the dock. Don't spend the money. Don't spend the money on doctors. Don't buy everything you can possibly see. Don't invest in technology and crazy things until you have to. But when you have to, you better jump in that boat really, really fast, because it's going to speed away 70 miles an hour. And that's what we're seeing today. So this is hard to see, I know, but it's all over the internet. This is the slide Terry brought to us in 2012, those of us who were on the board, and showing us how we were going from this volume-based healthcare to a value-based healthcare. So we were going from fee-for-service, we were going from everyone being independent, acute inpatient hospital focus. It was all about keeping the hospital full. I can remember going to hospitals and walking in the door and the CEO suite and saying, how are things? And they would immediately tell me their census. That was the important thing. How many heads in beds? How many people do we have? And then all of a sudden it flipped. And then it was like, we don't want to be full. That's a bad thing, right? Because we're trying to treat people outside of this very expensive environment called a hospital. And that's value-based healthcare. And in value-based healthcare, what you do is you align yourself. So let's just take physicians. You align yourself, you align your goals. And so you form associations and payer sorts of products where you're bundling them and you're incenting a lack of utilization, and you're incenting a lack of watching tremendous testing and costs go up. And most of the rest of the country is value-based and has been there for a while. And we have some dynamite examples of that here in Baton Rouge. Now, that's a bit in the weeds for the average person, but that's why you're seeing some of the things that you're seeing right now in Baton Rouge, because we are going through that. And we were late to that party, in my opinion, and we got to jump in that motorboat as a community very fast, because that's the way things are going. So I think a lot of people saw in some of the news stories about electronic medical records, the EPIC system, legacy systems. But I got to tell you what, it's not just about keeping people's data and information in an electronic format or a database. because the leaders are now able to share that and use that with meaningful impact on people's health care, where it's triggering something for the physician to say, this person needs to have this. It's connected to monitoring devices, or it will be connected to the Internet of Things and all these things that we wear that pick up heartbeats and AFib and everything else. So I think that where we're going is in a sophisticated direction that some of us haven't even thought of and can't even imagine. There's a focus on increasing engagement strategies, engaging the consumer, the healthcare consumer, online apps and telemedicine being one, but using care management teams. Because the reality is, if we're going to keep you out of the hospital, then you have to be compliant. You have to know what you're supposed to do when. And I got to tell you, that it gets harder and harder for me. You know, I go to the eye doctor. What did she say? What did she tell me to do? What do I do with these drops? Am I supposed to do them every day for a month? Every day for a week? I look for it. Where are my notes? What did I write down? So I think that, you know, when you look at this on a large scale, there's a tremendous opportunity there. When you talk about population health and minimizing risk and going up to scale, I think we're going to see much more emphasis on team structures, and I think they'll even cross healthcare lines. I think that they'll cross into schools. I think that they will cross into social service agencies. And so what we will have is a new model where the consumer or the healthcare consumer, I really hate that word, healthcare consumer, but I don't like patient either, where that individual that we all want to take care of has a myriad of people who are all working together to try and make things better. And that will include care coordinators, pharmacists, nurse practitioners, et cetera. And when you begin to see things that way, you realize that that's going to take a lot of changes. So this is a quote that talks about what physician alignment really is. And just because you buy a physician practice or a lot of physicians does not necessarily mean that you have real alignment. And unfortunately, we see a lot of hospitals that have spent a lot of money buying a lot of docs who then get dissatisfied, leave, rest on their laurels, act as anchors around the organization's neck. And so a lot of this has to do with going beyond this and looking at the culture of the organization. I can't emphasize the importance of culture, and you've all heard this quote, culture eats strategy for breakfast. There are people in this room who will remain nameless who have worked at Our Lady of the Lake and the Baton Rouge General. And those are different cultures. I worked for the St. Joseph's healthcare system in Orange, Texas, in Lubbock, Texas. They have a very unique culture. I was told the first day that I was in Lubbock, now don't say these things in front of the sisters. I'm like, is that a joke? No, we don't talk about these things in front of the sisters. They don't want to know. They don't want to hear it, so we don't talk about it. I thought, how's that working for you? I mean, we're not going to talk about cost, really? Because that's money, and that's nasty stuff. Now, they got over that real fast, okay? They're one of the largest systems in the United States today. But the reality is, culture has a lot to do with the success of the organization. There are tremendous talent wars. They're going on in your organization. They're going on in healthcare. But when we think about the competition, it's not who you think it is. So we got everybody going to Ascension Parish. Everybody's health care is going to Livingston. Cleveland Clinic is going to Abu Dhabi and London. The last part of this statement, only 1 in 200 Americans receive care at Cleveland Clinic, but the last statement, it's our ethical obligation to serve as many patients as possible. Coming to your neighborhood soon. So I think that, when you start seeing all this emphasis on virtual reality and robotics and artificial intelligence, what you realize is that our world is going to continue to change. And that's a good thing. It's a good thing. It changes uncomfortable. We never really like it. But this is corporate America. When do you think your company will buy at least one healthcare service from Amazon or Google? And most of them said pretty soon. Yeah, we're ready for that. So when you live in the world of healthcare, none of this is a surprise. When you think about life from outside, I don't think we always realize this. I'm going to leave you with this one thought. Jared from the mayor's Healthy Lives organization presented at the Leadership Greater Baton Rouge program last Friday. He has some marvelous slides, if you ever have a chance to see them. He has a slide that says your life expectancy changes over 15 years if you are on Park Boulevard at Perkins Road and you turn right or you turn left. I leave you with that thought because that's our community, and I thank you for all that you all do. Thank you very much. I went right up to the end.
Meeting is adjourned.
And you thought you were going to get rid of me.
I want to take a. Brian,
All right.
Brian, welcome, my friend.
Thank you much. I greatly appreciate it.
Yeah, yeah. Good, good. It's a good group for you.
Your slogan.